All right, today we're going to tackle something that sounds like it's straight out of a sci-fi movie. A heart that's literally built backwards. We're going to unpack what it is, the incredible challenges it creates, and the amazing medical wizardry that's used to manage it. Let's get into it. Just think about this for a second. What if the two main pumping chambers in your heart, the ventricles, were swapped at birth? The one built for the easy, low-pressure job of pumping blood to your lungs is suddenly stuck doing all the heavy lifting for your entire body. This isn't just some weird thought experiment. It's the reality for people born with the condition we're exploring today. So here's our game plan. First, we'll look at the fundamental wiring mistake in the heart. Then we'll get into the huge problem this creates over time. After that, we'll explore the incredible surgical fix, the all-important support systems, and finally, the new way of thinking that's changing everything for these patients. Okay, so let's get right to the heart of it and figure out what's actually going on with this anatomical puzzle. The official name is a mouthful, Congenitally Corrected Transposition of the Great Arteries, or CCTGA. Now let's break that down. Normally, your super strong left ventricle pumps oxygen-rich blood to the body. In CCGA, the ventricles are switched. But, and this is the wild part, the big arteries leaving the heart are also switched. This double switch accidentally corrects the circulation, so oxygenated blood does get to the body. The catch? It's being pushed by the weaker right ventricle, creating a system that works, but is living on borrowed time. And that ticking clock leads us right to the central problem of this whole story. You just can't ask an engine designed for a golf cart to power a semi-truck forever. At some point, something's gotta give. This really lays out the fundamental mismatch perfectly. On one side, you have the morphological left ventricle. It's an absolute powerhouse, thick-walled, built for the high-pressure grind of supplying the whole body. But in CCTGA, it's basically on vacation, just doing the easy job of pumping blood next door to the lungs. Meanwhile, the weaker, thinner morphological right ventricle is forced into this high-stress job it was never designed for. It hangs in there, sometimes for decades, but that constant, relentless strain eventually takes its toll. And this is the magic number cardiologists are always watching. It's called the ejection fraction. Basically, it's a report card on how well that main ventricle is pumping. When it dips below 45%, that's a huge red flag. It's the heart's way of saying, hey, I'm getting tired. It tells doctors that the wrong tool for the job is starting to fail, and it's time to think about a major intervention. So if the basic problem is having the wrong engine doing the wrong job, what's the most logical solution? Well, you perform a complete engine swap. And that brings us to one of the most incredible procedures in modern medicine. The whole point of the surgery, what they call an anatomic repair, is to restore the heart to the way it was supposed to be designed. The entire goal is to get that strong, powerful left ventricle back into the driver's seat, doing the job it was born to do, powering the body's entire circulation. It's called the double switch operation, and it is just unbelievably complex. First, surgeons sometimes have to retrain that lazy left ventricle so it can handle high pressure again. Then, they basically reroute all the plumbing in the heart's upper chambers, the atria, to make sure the oxygen-rich blood goes to the strong ventricle. And finally, they physically snip and switch the great arteries, the aorta and pulmonary artery, and hook them up to their correct positions. It's just a true marvel of surgical engineering. But look, a massive surgery like that isn't the whole story, not even close. Managing CCTGA for the long haul requires a whole support crew to deal with all the other issues that this unique anatomy can cause. So let's see what that looks like. First up, we've got the valve. See, in a CCTGA heart, the valve leading into that overworked right ventricle is a tricuspid valve. It's just not built to withstand that kind of pressure. As the ventricle strains and stretches out over the years, the valve often starts to leak and leak badly. And this is where the thinking has completely changed. Doctors used to wait for the ventricle to fail before they'd even touch the valve. Not anymore. The best practice now is to get in there and repair or replace that leaky valve before it causes permanent damage. A severely leaky valve is a massive predictor of bad things to come. And for patients who might be too sick for another open heart surgery, they're now even developing amazing, less invasive ways to fix the valve right through a catheter. Next up, the heart's electrical grid. Because the whole heart is wired backwards anatomically, the internal conduction system, the tiny electrical pathways that coordinate the heartbeat, is also abnormal. This puts patients at a really high risk for rhythm problems. A super common problem is something called an AV block, where the electrical signal just can't get from the top of the heart to the bottom. That almost always means you need a pacemaker. But a simple pacemaker can actually make the ventricle pump in a clunky, inefficient way, which can weaken it even more over time. So the best practice today is to use a special kind of pacemaker called cardiac resynchronization therapy, or CRT. It uses extra wires to basically resynchronize the squeeze, making it much more powerful and efficient.
And of course, there's medication. For a long time, doctors have used the standard lineup of heart failure drugs, but honestly, nobody was totally sure how well they worked on a systemic right ventricle. But that picture is finally starting to change.
And this is the really exciting part, maybe a real game changer. These newer classes of heart failure drugs, you might hear them called ARNIs and SGLT2 inhibitors, are now being used in CCTGA patients. And the initial results, they look really promising. It seems like these could be a powerful new weapon in the arsenal to help support that overworked ventricle and keep it stronger for longer. So when you pull all these pieces together, the incredible surgery, the smart valve management, the advanced rhythm control, the new medications, what you start to see is a whole new philosophy taking shape. And this right here is the key takeaway. The way we manage CCTGA has totally flipped. It's gone from a reactive approach, waiting for things to break and then trying to fix them, to a deeply proactive one. It's all about anticipating problems, the ventricle getting weaker, the valve starting to leak, the rhythm going haywire, and stepping in early with a personalized plan to keep that heart as healthy as possible for as long as possible. And that leaves us with a much bigger question to chew on. The story of CCTGA isn't just about one complex heart condition. It's a perfect example of a huge shift happening across all of medicine. As we get smarter about predicting the course of all kinds of chronic diseases, how is this proactive mindset going to completely redefine what it means to live with one? It really points to a future where we're not just treating sickness, we are actively managing health. Thanks so much for joining me.